We're here at the Carling Heights Assessment Center, one of two in the city used to screen people for COVID-19. Today we spoke to Chief Medical Officer of Health, Dr. Chris Mackey, about the current situation in London and what's to come.
Yeah, assessment centers opened on the 16th, about a week and a half in. We saw the peak very early in terms of the number of visits at the assessment centers. A lot of people who I would categorize as the worried well, that were looking to have questions answered, just wanted to get checked out. The peak was second day at 500 case. People coming through to get checked out. We're now down to around 240, 250 depending on the day. And lots of people who needed information about how to self-isolate and information about how to manage their symptoms and when to stay home and when to come back out into the community. So lots of good discussions happening there. Our total case count is going up because there's really nowhere else for it to go. The case count, we're not going to undiagnose people retrospectively, but actually we haven't had, our highest case count was about a week ago, 6 cases. Since then we have had no more than 3 per day, and some days as low as 0. So we're not seeing really a strong increase in cases here in the London and Middlesex area. Across the province you are seeing a continued rise in cases, not surprising at all, but you're also seeing those cases start to slow down in terms of how quickly they're doubling. So that's an encouraging sign here. In places where the disease is going unchecked, cases are doubling every 2 days. So, 2 days from now we have twice as many cases as we do today. Here in Canada, that's more like every 3 days, and in Ontario it's trending to every 4 days or more, which is quite reassuring. It means we're starting to see the exponential growth slow down. That's really changed over the last couple of weeks, and so that suggests that the public health measures that we've put in place, things around the physical distancing and closing down non-essential businesses, are really making a difference. Very encouraging. The next couple of weeks will determine whether this is going to be a huge pandemic wave in our community or whether it's going to be a ripple. And that really depends on people staying home to stay safe, staying home to save other people's lives, especially if there are any symptoms of respiratory illness. Please do not be out in the community and take all precautions to protect your family. Yeah, airborne is a term that we use for a very select number of diseases which can actually kind of float through even room to room or through ventilation systems. That is definitely not the case with coronavirus. Coronavirus is droplet spread, which means you've got to be within a kind of 2 meters, sneeze, cough, drops off about 2 meters, and you really won't get infected beyond that. It can be transmitted through surfaces, so cleaning down high-touch surfaces like doorknobs or countertops or that sort of thing actually can make a really positive difference, but this isn't something that is airborne. That's really encouraging because we know how droplet spread diseases are spread, and we know that they don't cause the sort of massive pandemics that would really infect a high number of a high percentage of the population. We're seeing people are really taking the physical distancing and the stay home messaging seriously. I think that's really setting us up for success. I'm also really encouraged by what I see in the healthcare system. Hospitals are very much taking this seriously, preparing in terms of making sure they have beds available, extra equipment, extra supplies, so that when the peak comes, which should be sometime within the next few weeks, our healthcare system will be as ready as possible. Yeah, can't say for sure. Ideally within a month the peak has passed, and within a couple months we're starting to get back to normal, but we really can't say for sure. Well, under about age 10, the risk of death is pretty much 0. If you look at even the Chinese data where mortality rate's been higher than it has been here, the rate increases directly with age, and then when you get above 70, it's in the range of 10% risk of death, which is quite significant. Well, this is exactly what we train for. You're absolutely right. And it's not like we ever hope, this is sort of training you hope you never have to use, but when the day comes, we're ready. And so, we've had a significant surge on our demand in obviously the infectious disease area, and we've been able to shut down most of our programs and take all of the staff and put them on the coronavirus pretty much, except for some of our very, very essential services. And people, this is exactly what we do when we need to do it, and we're here for our community.